Good afternoon, everyone, and welcome to this week's press conference. I'd like to welcome you all on this warm Friday afternoon. I'd like to start by giving apologies from Councillor Golby, who's experiencing some rather difficult technical issues today. So please bear with me as I muddle my way through this. I'm sure we will all be good. So I'd just like to introduce everybody that we've got on the panel today. We've got Nisha Patel, COVID Intelligence Lead at Northamptonshire Health and Care Partnership. We've got Sharon Oakey, who's the Director of Nursing, Midwifery and Patient Services at Northampton General Hospital Trust. We've got Chris Pallow, Programme Director of the COVID Vaccination Team. We've got Simon Blatchley, Assistant Chief Constable from Northamptonshire Police. We've got Dr. Joanne Watt, GP Chair from Northamptonshire Clinical Commissioning Group. We're also joined today by Paul Andrews from the COVID School Cell and by Dr. Annapurna Sen, Northamptonshire Health Protection Lead, who's here representing Public Health Northamptonshire today. So we'll begin in our usual way with an analysis of this week's surveillance report, which will be presented by Nisha.
Thanks very much, Kath. Alicia, could you start the slides, please, on slide 2? Thank you. So we all eagerly await the return of our liberties on Monday, which marks the next hurdle, and it's something that I know we've all long awaited. The final step was marked out by the government, and this slide really shows kind of what that step means. This moment marks a change in many ways from the limitations that have been placed on us towards more of a kind of social contract where we all need to do our bit to help ensure that we carry on moving forwards and certainly not backwards. Next slide, please, Alicia. So you can help yourselves, your friends and family and the wider community by doing these very simple things. I know you know what they are by now, and in some ways we've had a year or more of training towards this, but I can't overstate how important they all are in helping us to keep moving forwards. So number one, we've made every effort to kind of getting a jab as easy and as simple for you as possible. There's drop-in sessions now available, and we've provided details here on how you can access that, and I know Chris will cover that later as well. Number two, even if you've had your jabs, please keep going with the twice weekly lateral flow testing. The jab protects you from severe illness. The test protects those around you because you can still transmit the virus and have no symptoms. So in order for us to suppress the virus this summer, please go and get your free test kits. Test yourself and upload all the results, whether they're positive or negative. Number three, exercise common sense and caution as you go about your lives. The weather's on your side, so meet outdoors if possible. Keep windows open if you can't. Don't discard your mask. Wearing them in crowded places, on public transport and so on is really sensible. And exercise good hygiene. Cover your nose, mouth when you sneeze. Wash your hands. Sanitize as often as you can. And please stay at home if you're unwell. Next slide, please. On this slide here, you'll find information on what the lifting of restrictions on Monday does and what they may mean for you. That's all there for you to go through at your pace. Next slide, please. Now, I know testing can and has confused some over time. If you are confused, I hope this is as simple as possible for you to understand. If you have no symptoms, do a lateral flow test. They're free, they're easy to order or source, and they take moments to do. Incorporate it into your routine and it becomes second nature. If you do have symptoms, you need a PCR test. You can either order a home testing kit or you can go along to a testing site, details of which are in this pack and online. The worst thing we can do is nothing. Ignoring symptoms or not doing regular testing allows the virus to circulate unchecked. We all want our kids back at school. I want a good summer. We all want people to be safe. Please help by doing these simple things and keeping us going on this journey. Next slide, please. Right, so let's get into the data. In the last week, we've seen 1,349 positive tests for COVID-19 in Northamptonshire. That's a 20% growth on what we reported last week. And it's markedly different to the patterns we were certainly seeing back in April, May and early June, as you can see on this chart. Next slide. And as you can see here, in the context of England levels, we have got significantly lower case rates in our county. This is replicated when we look at unitary authority levels for Northamptonshire and West Northamptonshire, but also within our kind of local areas. However, case rates have still increased everywhere in the last week, with the highest infection rates in South Northamptonshire, where rates are double that of North Northamptonshire. Next slide. Now, here we can see how the picture on case rates has changed over time. We can see that the England case rates, and you can see that in the uppermost dotted line on this chart, remain higher than the Northamptonshire county position, which is the dashed grey line, kind of in the middle of that chart. You'll note that South Northants continues to see the highest case rates in our county, followed by Daventry and then Wellingborough. All local areas have seen growth in case rates, but the most recent data shows that the growth in Daventry and Wellingborough may be easing off slightly, though as you know by now as well, this is subject to change and fluctuation. Next slide. Oh, can we go to slide 10, please? Thank you. So this chart shows the ebb and flow of case rates by looking at the percentage change in the 7-day rates over time. Bars that move in the upward direction over time show percentage growth, and we can see most recently that acceleration in cases locally. But most recent information suggests that the rate of increase has started to reduce since the 2nd of July. Next slide, please. Now, an overwhelming majority of cases at this time are amongst those aged 10 to 19, followed by the 20 to 29 age group, with more men than women testing positive in the last 28 days. There is further information in this pack regarding cases within education settings, which shows recent increases in cases, particularly amongst pupils. 7 out of 8 of our current outbreaks are also within education settings. Now, school summer holidays may begin to disrupt some of those chains of infections amongst school age groups, and that certainly would be our hope. But it doesn't address the full picture you can see on this slide. This is a compelling case for younger adults heeding the advice today to be cautious as we step into Monday and as restrictions are lifted. I know the last year has been disruptive and hard on young people, but I hope they'll continue to play their part in helping to keep our communities safe and moving away from this chapter. One reason that's so important is in the past, we would have seen household transmission spread to older ages, and we are currently seeing cases rise in the 60+ population too. And as you know, this is usually an area of concern for us. Next slide. Now, for me, this is one of the most critical slides in this pack. It shows the number of people in hospital with COVID-19 in Northamptonshire. The latest data in this pack is for the 13th of July, when there were 16 people in hospital, and that's increased above 20 today. I'm also pleased to say there were no COVID-19 deaths in the within 28 days of a positive test in Northamptonshire in the last week. Now, a key thing to note is that the number of people in hospital relative to the community case rates is low compared to what we've seen before. When you look at admissions and deaths compared with case rates over time, you can see the power of doing the right things, like going to get a vaccine and protecting yourself. So don't delay, get your jab today. Slide 19, please. So I'm not going to necessarily go through the rest of the slides that are in this pack, but they are there for people to read at their leisure. We will, however, continue to support people in Northamptonshire through a range of resources, information and advice this summer. This is a selection of places that you can engage with us through this next step. Thank you very much. Thanks, Kath.
Thank you, Nisha. Great to have you with us presenting that data today, and thank you very much for your message there. Indeed, don't delay, get your jab today. I'm sure Chris will have more to say on that. Our next speaker is Sharon Director of Nursing and Midwifery and Patient Services at Northampton General Hospital. So I'll hand over to you, Sharon. Thank you.
Thank you very much, Kath, and good afternoon, everyone. So I'm here to give you an update from the acute hospital's perspective. And I'm going to start off talking about our non-elective pressure on our services. So both here at Northampton and at Kettering, we're continuing to be concerned about the high numbers of local people attending our two hospitals' A&E departments. Both hospitals continue to see high daily A&E attendances in the hundreds. In A&E at Kettering, we're seeing up to 360 patients a day and up to 440 here in Northampton. If you compare that to the same time as June 2019, that's 1,400 extra patients more per month across the two hospitals, which we do have to consider is quite significant. That creates a great pressure on the departments with the potential for overcrowding and an increased risk of COVID transmission. A lot of the people attending A&E with minor injuries or illnesses or trying to fast track themselves for hospital care with joint and long-standing issues. Of course, there are also people that genuinely need medical and surgical emergencies, and those patients do need hospital care. We totally understand and accept that there is a frustration about being able to access NHS care quickly, but this is because many NHS services, including GPs and Corby Urgent Care Centre, are running hot at the moment with lots of patients seeking attention. So the request is simple. We would urge people to seek advice from NHS 111 or their local pharmacist where it's appropriate, so that the local NHS and GP services can concentrate on those most in need of our care. I also want to mention our staffing. We're seeing our staff absences in both of our hospitals rising. As of yesterday, we had a total of 136 staff from the two hospitals absent due to the need to isolate. The reasons being their children catching COVID, or they've been close to somebody with COVID and have had to isolate. That's almost double the numbers that we had a month ago. Obviously, the additional pressure at the front door puts actual additional pressure on our beds. We have a small but concerning growth in the number of hospitalised patients with COVID-19. Across the two hospitals today, we have 24 COVID positive patients, which doesn't really compare with those that we had at the top of our second peak, but this is a concerning increase happening. We have a small number of children requiring admission, and they've tested positive. The reasons for admission, though, may not have been COVID. There are no major differences in how we treat our adults and our children. We will, however, continue to deliver care in the way that we have done for the past 18 months. We are not going to change our infection prevention practices, and colleagues later on in the presentations will highlight that further. Our restricted visiting continues at the current time, but it remains under review, and we will have to change it if the need is there. Thank you.
Thank you very much, Sharon. Some really key messages there to take away. Thank you very much for your input there. Next up, we've got Chris Pallow, Programme Director from the COVID Vaccination Cell.
Thank you very much, Kath. Good afternoon, ladies and gentlemen. So the latest position for the vaccination programme in Northamptonshire is that we've now delivered over 880,000 vaccines to the members of our population. 502,000 are first doses, and that's for the very first time we've broken 500,000, which is absolutely wonderful news, and huge thanks are due to every single person from across the county that have helped with the programme. Hundreds of people in primary care, in the hospital hubs, at the vaccination centres, both NHS staff and those who've come forward to volunteer to assist us. It's a true testament to all of the partners working together across Northamptonshire that we've been able to get to this position. The vast majority of our over 50s have been double jabbed, which is again excellent news for the reasons that Nisha has already outlined in terms of protecting yourselves and your loved ones and your families. Uptake in the 18 to 24-year-olds is 67%, and 25 to 29-year-olds is 70%. So there is still some way for us to go in that regard. For the over 30s, it's at 79%. So we have made fantastic progress, and thanks is again due to everyone who has helped us. But we aren't done. There are still many people who can come forward to have their vaccination, who at the moment have not yet taken up the offer, which has been made to everyone over the age of 18 across our county, with appointments available at GP surgeries, at our community pharmacies, and at the vaccination centre at Royal Pavilion at Moulton Park. We continue our journey to vaccinate everyone that we possibly can. Tomorrow, between the hours of 9 and 5, there is an open access service at Market Square in the centre of Northampton. If you haven't been vaccinated yet, please come forward. No appointment is necessary and we will take care of you. If you can't get to Market Square tomorrow, the vaccination centre at Moulton Park is open from 8 till 7 every day for walk-ins. You can come at any time. There'll be news next week about open access sessions in Corby Town Centre a week away from now on Saturday and Sunday. So my message to the population is this: thank you. Thank you to everyone who's come forward and helped to protect themselves and to protect their loved ones and members of the public, and help us move forward to this wonderful event on Sunday when we can get many of our freedoms back. If you haven't come forward yet, that's fine, but please come forward now. We have a vaccine for every single person in Northamptonshire over the age of 18, and I would love that to be delivered to every person over the age of 18, because we're then safer as we move through the rest of the summer. Thank you very much, Kath.
Thank you, Chris. And thank you to your team and everybody involved in the vaccination programme. I think we all agree there's a great piece of work going on there, so thank you. Next speaker is Simon Blatchley, Assistant Chief Constable from Northamptonshire Police.
Yeah, good afternoon. Thank you. All I can do really is echo the comments that have been made by my health colleagues. As a police service, we're seeing our demand have reached back to normal, and all we're asking the public really is to please follow the guidelines that have been given. We're aware of the Freedom Day on Monday. We'll ask people to please comply with the guidance and the decisions that are made by shops and premises and follow those. We will, of course, attend if necessary, but we're hoping people will just comply. If a shop says, please wear a mask on public transport, please comply. We don't really want to be attending any disputes, but if we absolutely have to, we will. As a police service, we'll be trying to keep our staff safe. So we are still, any police officers that you see will be wearing masks. They will engage with you wearing a mask, and they will still be socially distancing. If they're double crewed in a vehicle, you'll see officers still wearing masks. And around police premises, we're still using social distancing, limiting numbers in rooms, and complying with all of the guidance as it is. So for us as a police service, internally, Monday won't see huge amounts of changes, and we'll carry on with those protocols. So please, a message from the police is please just follow the guidance given and keep everybody safe. Thank you.
Thank you, Simon. Nice, concise report, but very clear. Thank you very much. Our final speaker will move to Dr. Joanne Watt, GP Chair, Northamptonshire Clinical Commissioning Group. Over to you, Joanne.
Thank you. So very much support all my colleagues that have spoken so far. It's important to remember there are no new freedoms as far as healthcare is concerned. So everything will continue exactly the same from the point of view of staff, patients, visitors. It is exactly the same. There is still an expectation that you will be wearing a face covering. Staff will still be wearing the same amount of personal protective equipment, and that's really important, particularly in light of the rising numbers, that we avoid healthcare settings becoming a source of infection where things can be spread to other patients. So it's really important that when you're in a healthcare setting that you wear a face covering to protect and respect others. It's not just about your personal risk. You don't know if the person next to you is particularly vulnerable, and you're wearing a face covering to protect other people as much as you're wearing it to protect yourself. So it's really important that you do that. GP surgeries will continue to offer face-to-face appointments as we have done throughout the incident. There are 17,000 GP consultations in surgeries all over Northamptonshire every single day. 60% of those are face-to-face. The health professional you see will be wearing a face covering, will be wearing PPE, and will expect you to do as well. And we really appreciate all of those people who continue to do that, keep themselves safe, but also keep the people around them safe as well. So thank you everybody for continuing to do this. I'm sorry there are no new changes in healthcare. This is what we're doing to keep you safe and to keep people around you safe as well. So thank you everybody for complying with that.
Thank you very much. So that concludes our panel speakers. So we now move on to the section with our questions from media. So I'd like to invite Stuart Radcliffe from BBC Look East to ask your first question. Stuart, over to you.
Hi, yeah, I was just wanted to ask a question about Silverstone, how concerned the panel were about large numbers gathering at Silverstone with the Grand Prix this weekend, and are they confident that, you know, a venue like that will be able to minimise any risk? And then the second one I just wanted to ask was just about face masks. As it's not a legal requirement, how concerned are they that people might not follow guidance in shops and offices, etc., and on public transport to wear face masks, and what risk does that pose?
Thank you, Stuart. So I'm going to pass this question to Dr. Annapurna Sen, our representative from Public Health today.
Thank you, Kath, and good afternoon, ladies and gentlemen. And thank you, Stuart, for your question. So answer to your first question about the Silverstone, I would like to let you all know that Silverstone is a part of a national event research program, which aims to examine the risk of transmission of COVID-19 from attendance at events and explore ways of finding out a right balance between returning to a normal way of life and living with the virus. We are at a point where 2/3 of our population, adult population, are now fully vaccinated, and COVID-related deaths and hospital admissions remain comparatively low, and we still have regular testing to detect asymptomatic individuals. And as you all know, Silverstone being an outdoor event, there is a lesser risk, and this is a national study, and its findings will provide us evidence to support bringing back life to normalcy. However, I can inform that this ERP event is overseen by DCMS, DHSC, as well as National PHE team. And in addition to that, Northamptonshire Local Resilience Forum partners have carried out risk assessment, site visits, and had sought assurance from Silverstone Circuit on recommended control measures. So we hope it will go, it may not affect hugely and increase our infection rate. Thank you.
Thank you, Annapurna. And with regard to the second question about face coverings, and would you be advising that they stay in place come Monday? Have you got a comment on that one?
So locally, Northamptonshire Public Health endorses and will support national government emphasizing caution and expectation for gradual easing of restrictions based on informed choices and personal responsibility of using face covering. So we do support use of face covering, specifically in indoor areas with the poor ventilation, public transports, and high-risk settings, such as Dr. Jo Watt has already said, like healthcare settings, care homes, and all these places. And I would invite Dr. Jo Watt to add her opinion on that, please.
So this is very much a position that's supported by NHS England's Chief Nursing Officer. There was a press release yesterday, very much supporting and say all healthcare settings, any environment where it's poorly ventilated, where you're indoors, absolutely encourage people to wear a face covering. That allows the more vulnerable people in our society to freely circulate, and it's really important that we give them the confidence to do that. So it is not just for you, it's for other people as well. Please keep those around you safe and continue to wear face covering when you are in an indoor environment, particularly if the ventilation isn't very good or if it's crowded. Thank you.
Thank you both. Are you happy with that answer, Stuart?
That was great. Thank you very much.
Thank you very much. Our next question is from the Global Media Group, who we answer the questions for them, and they'll pick them up later. So their first question relates very much to the previous question about the Grand Prix. So just ask Anna if you've got anything to add to this. How confident are you that the Grand Prix won't lead to a spike in new cases locally? And has the continued spread of Delta variant changed any plans or preparations for the event, either by public health officials or the circuit's organisers over the past week?
Thank you, Kat. Thank you. As I have already answered the question before that, and I would still re-emphasize that as part of the ERP program, national teams are ensuring all control measures are, as well as local teams, we have also sought assurance from them. Now, in answer to the COVID Delta variant, so the COVID Delta is not a variant of concern anymore, as it is now a dominant strain circulating, and to add to that, event planning is not dependent on Delta variant, rather ensuring control measures are in place to protect spectators as well as our local population. So there are specific requirements as part of the ERP program to enter the circuit. These are COVID certification, as we all are aware, and showing either you are fully vaccinated or negative LFT before entry. That would be one of the control measures to prevent transmission. And local authority is also ensuring adequate control measures are in place for campsite, hotels, and businesses. And just to let you all know that any social mobilization and inclusion, case transmission may increase. Therefore, step 4 implementation may impact our case rate, and it will be our personal responsibility to take adequate precautions. Thank you.
Thank you. A further question from the Global Media Group. What has led to the introduction of the new lateral flow device testing van, and what are you hoping to achieve by having this? And I'll go back to Annapurna again, please.
Thank you, Kat. So answer to that question is that the Department of Health and Social Care have recently changed the testing parameters with the emphasis on reaching underrepresented groups or people who are disproportionately affected. This has given us the opportunity to move towards more flexible ways of working and will enable us to access communities where take-up of testing has been lower. Educating and engaging with visitors to the unit on how to use the lateral flow test correctly and providing a test kit to take away, as well as additional information on how to source future test kits is one of our main priorities. One of the other main priorities to ensure we continue to offer asymptomatic testing to all our residents. We hope that we can help communities to understand the importance of testing, how to access test kits, take tests, and record their results. This will ensure we keep ourselves, our loved ones, and the community safe. Thank you.
Thank you very much. And a final question from Global Media Group is to Chris Pallow. Are there geographical or demographic pockets within Northamptonshire falling behind the vaccination uptake?
Thank you, Kath. So there are a number of ways that I can answer this question. Firstly, we know that there are some locations within Northamptonshire where the uptake has been lower than for the rest of the county. And our data now drills down almost to street level. So there are small pockets within Northampton town, within Corby, and a very small pocket within Daventry, where the uptake hasn't been as high as we would like. So we're supporting those areas in a number of ways. Firstly, we're making pop-up and open access services available, such as the one I've already mentioned in the Market Square tomorrow in Northampton, and the plans we're putting in place for Corby. And we're also working with our colleagues at the councils to go to those locations and to help to educate and to invite people living in those areas to come forward for vaccinations, to make sure they're aware of all of the options that they have. From a population perspective, I've already mentioned that whilst uptake has been very good across all of our age groups, those in the 18 to 29 and the 30 to 39 age categories we haven't yet achieved the same coverage as we have for the slightly older members of our population. And again, that's why I gave that really important message that the vaccination service, whilst we've met this great milestone, is not going anywhere and is still there for you to access. And I'd really like you to access it as soon as possible. And then the final element to my answer is around some different communities within our county. And in particularly, we've seen that the Eastern European community has been slightly more hesitant to come forward for their vaccines than others. There is absolutely no criticism at all in what I'm saying, more that we need to work really very hard with that community to help inform them about the benefits of the vaccinations and work very closely with their community leaders to ensure that they're fully informed and can come forward just like everybody else. So a number of answers to that question, but the most important message is this: come forward now. We'll take care of you.
Thank you, Chris. A very thorough answer. Thank you very much. So our next set of questions comes from Kevin Nichols from Northampton Chronicle and Echo. Afternoon, Kevin.
Hi, Kath. How are you?
Thank you.
That's good.
Would you like to start with your questions?
You're doing very well, by the way. Thanks for doing it. Yes, one for Sharon Oker, if I may. You mentioned 24 COVID patients are now being treated. I wonder if you can give us a number on how many of those are in critical care at the moment, requiring ventilation, and also a general idea of the age groups of the people that are being treated. We get the feeling that it's a younger age group than it has been previously, and also what proportion of those may be vaccinated or not vaccinated.
Hi, Kevin. There's 3 answers to that, isn't there? I'll try and remember them in the order that you've asked me, so you might have to prompt me on that one. So you asked me, you asked about the, just remind me again, you asked me about the age ranges?
Age ranges, yes. How many in critical care and vaccinated, not vaccinated? Okay,
so the age ranges, there's a wide variety from teens to the 90s who've tested positive. Mainly, the feeling is that they're unvaccinated patients, but there are a range of ages of patients that are currently tested positive. In terms of critical care, I think we've got 1 patient in critical care currently, but obviously that's a changing feast. And sorry, just remind me what your third question was.
I think you've done it actually. It was the unvaccinated or not vaccinated. You say that those being treated in hospital are from teens to 90s, yeah?
Yeah.
Thank you.
Thank you. And Kevin, you had some questions also for Simon.
Yeah, for ACC Bletchley, if I may. Yeah, the issue of face masks, I get the feeling we're sort of almost back to where we were when face masks came in, that it's going to be a particularly divisive issue. I just wonder how far you can go and how far you're prepared to go, supporting those establishments that want to insist people wear face masks before coming in.
I think thanks for the question. I think as I mentioned earlier, it's particularly if it's private premises, as it's an individual call by them, we will of course attend if we get a call for support, because obviously a lot of the COVID legislation ends on Monday, but we still have our breach of the peace, public order, etc., etc. So we'll attend and try and resolve. However, we'll obviously clearly ask in the public is to not put themselves in that position in the first place. That if any sort of, be it shop, premise, that says you do need to wear the mask, because as we mentioned here, health premises are a good example. Please just comply and don't put that position where we're having to sort of deploy police officers to try and resolve those situations. But if we do get asked to attend, we will do so. Thanks.
Thanks, Simon. Kevin, does that answer your questions?
That's brilliant. Thank you very much.
Thank you. So we move on to questions from Alison Bagley at Northamptonshire Telegraph. I know Alison's not on the line. Is there a colleague on the line on her behalf? Otherwise, I'll ask them.
I'd be very much surprised, Kath. To be honest, we're down to bare bones today as well, so I doubt it very much.
I'll ask them on Alison's behalf then. Thank you, Kevin. So the first question is, how many children are in Kettering General Hospital with COVID at the moment? Sharon, you touched on that. Did you want to add anything to that?
I mean, I touched on that when I made my initial report, isn't it? So we've had a very small number of children in hospital who've tested positive, and the reason for admission has been for another condition, which has necessitated their admission. So hopefully that answers Alison's question.
Thank you. And a couple more from Alison to yourself. So how many patients with COVID have had no vaccinations, 1 or 2, which you've covered as well? Do you have any further comment on that one?
Oh, I guess the message I would like to put on the end of that is, and I think Chris has already said it, but anyone who is eligible for a vaccination please could they go and get it, and make sure they have both vaccinations for full protection.
Thank you. And just finally, regarding COVID, what specific challenges are there for medical staff dealing with younger patients in comparison with older patients?
So I think I alluded to that, responding to that earlier. So there's no major difference in the way that we treat our patients for COVID because of their age. There may be requirements or different requirements in terms of treatment, such as oxygen, and often older people are more likely to have underlying medical conditions, which means they're more seriously affected by COVID.
Thanks, Sharon. Thank you very much for that. And final question from Alison to Dr. Annapurna. It's, would Lucy Whiteman support the compulsory use of face masks on our trains and buses and in public buildings after the 19th deadline? So in Lucy's absence today, Annapurna, would you like to give your response to this, please?
Yes, thank you, Kath. And I'll take this opportunity to answer on behalf of Lucy. I would say that public health will recommend that when we are in an enclosed indoor spaces and with poor ventilation, which is considered as high risk environment for a spread of virus, then wearing a face covering would help to reduce the risk of transmission. That's why we would advise to use face covering. People should make their own judgment on risk and take responsibility of maintaining social distancing and use of face covering in high-risk areas, such as indoor venues, public transportation, healthcare, and the social care setups. And so we do recommend that. Yeah, thank you.
Thank you very much. And last but not least, I believe we've got Martin from BBC Radio Northampton.
Yeah, hopefully you can hear me.
Indeed.
Good. A couple of points, really. The first is, it's been mentioned again that South Northamptonshire has the highest case rate in the county at the moment. Is anything being done specifically in respect to South Northamptonshire to address that higher case rate? And the other thing is about test and trace. We know it's being recalibrated because of the high number of people who are being told to self-isolate. Do we have any way of knowing whether that's been a particular problem in Northamptonshire? In other words, people being pinged by the app and being told to self-isolate.
Thank you, Martin. So we'll take the first question first. We'll go to Annapurna first, and then I think Chris would like to add a comment on the end. So Annapurna.
Thank you, Kath, and thank you, Martin. To answer to your first question, I would like to probably start with a comparison. The situation in the first wave when COVID was affected and the situation now with increasing case rate in South Northants are different. When COVID was affected, we were experiencing high case rates earlier in the year and COVID-related hospital admissions, deaths also, and we had no vaccines. This is not the case at this point of time. So the rising case rates are a concern, and we are continuing to support our local community through system-wide approach. That includes good communication, engagement, emphasizing our key messages. We are working with our marshals and environmental health colleagues to risk assess, then support and advise control measures. We also work with the settings that have outbreaks to contain them and stop further transmission. As restriction will ease further next week, the responsibility will lie on individuals to take appropriate precautions to reduce the spread of the infection. And this is about reflecting and making our own judgment on the risk and take appropriate precautions. And I would suggest we have vaccines now. So when we are invited, we should go and receive and get fully vaccinated. And Chris, please, can you add on to that?
Thank you. It's another plug, really. So firstly, it's just a request to members of the press. If you can help us to publicise all of the walk-in locations, dates, times that we've got around the county, I would be hugely grateful to you all. And with regards to that very specific question about South Northamptonshire, our colleagues at Greens Norton Community Centre have an open session tomorrow, Saturday the 17th, 9 till 4, for anyone over the age of 18 to come and get their first dose. So that just is another part of our package of support for that part of the county. Thanks, Kath.
Thank you both, and thanks, Chris. And yes, please do urge anyone to go along to that centre this weekend. It's a good opportunity. I'm just coming back to that second question about the Test and Trace app. Again, I'm going to come to you, Annapurna, for your response on that one, please.
Thank you. Thank you. So Martin, we do recognize that there are technical issues with the app, and we are monitoring its impact at a local level. Nationally also work is being done to resolve the issue. And I think the part of your question is, will recalibration put us at risk? To answer that, so recalibration will not be a risk, because any positive case will be contacted by Test and Trace to identify contacts and advise accordingly. An answer to a question on ignoring an app. So it is an application on a phone which we will as a system not have access to. And the app is to help a person and raise awareness that he or she has been exposed. And as a system, we do not have any legal requirements. So that's our stand on it. Thank you. I hope that answers.
Thank you, Annapurna. Does that answer your question, Martin?
Yes, thank you very much.
Thank you very much. So that brings us to the end of our table questions. And actually the end of our planned press conferences to date. So I just really want to finish off by saying a few thank yous. These press conferences, are really very valuable for all of us. And I just want to first of all thank you to all of our media colleagues for your support, for sharing our messages, for attending and giving us the challenge and the support with everything that we're doing, and communicating the key messages to the public. It's much appreciated, and we've really very much enjoyed working alongside you and hope to continue to do so even without the press conferences. So thank you very much. I also just want to say a big thank you to our panel members, not just those on the call today, but everyone who's been on our panel back from our first press conference back in August last year. You're very important people with very important jobs, and we really value your time and your expertise and the opportunity that you bring to come and talk to us all. So I just want to extend my thanks to you. And final thanks to everyone behind the scenes supporting colleagues on the call, panel members, media colleagues as well. Really, we couldn't put on this event without all of your support. So I just want to take the opportunity to say thank you to you all. And in the meantime, as we lift restrictions on Monday, be safe, be cautious, and do follow the advice offered by panel members. Just assess those risks and take the appropriate action. Make sure you get your vaccinations when called and take up regular testing. And hopefully we'll continue on a road to more normality as safely as we can. So thank you all very much. And we'll end the call there. See you again at some point soon. Thank you.
Thanks, Kath.
Thank you, Kath.
Thanks, Kath.
Great job.